Okay, good morning, everyone. Welcome to Cancer Support Services. This morning, we have the privilege of having Dr. Almus McDowall here from St. Lucia. And Dr. McDowall is no stranger to Cancer Support Services, having been a friend of our Executive Director, Jan, for over 20 years, as well as the charity. When we were originally located on 14 George Street, we took over his 16 George Street office when St. Lucia, his home, needed him more. In fact, we still have his examination table, which was donated to the charity. So, Dr. McDowell, there's an opening to bring St. Lucia back to Barbados. Uh, Officially, Dr. Almus McDowell is a naturopath who is trained in natural medicine, Chinese traditional medicine, and acupuncture. Dr. McDowell is a licensed health practitioner on the island of St. Lucia and is a government-appointed board member of the St. Lucia Allied Health Council. He also holds a degree in Chinese medicine and acupuncture, as mentioned before. Dr. McDowell is a past student of the Wilfrid Laurier University in Waterloo, Ontario, Canada. I hope I pronounced that correctly. He is both a radio and television personality. He has a weekly health program in St. Lucia called Health Talk for over 15 years. Dr. McDowell has been in private practice for over 30 years, and he is an expert in alternative cancer therapy. So it gives me great pleasure now to hand over to you, Dr. McDowell, as you enlighten us on prostate health. You will have to unmute.
Minute. Now, can you hear me?
Yes.
Can you hear me?
Yes, please.
All right. Thank you so much. I'm very honored. That was a very long introduction, and I must say that it's a pleasure to speak to you all this morning, and I hope that I can share some light on the subject that we're about to speak on, and also to help many of our men, not only in Barbados, but around the region. And I hope that some of the information collected here today would be shared across our region. Now, I have been in practice, as you mentioned, for many years. I would say probably over 30 years I've been in practice, and I've worked with all kind of cases, and you name it, from diabetes to high blood pressure to cancer. I have seen all, and I must say that I've helped a lot of people. And the way that I practice is not, I do not practice alone. I usually will send a lot of my patients to see traditional medical practitioners. So if I do have a case, and this case is beyond me, I write a note and I send them to see an MD. Because I'm also, as you've mentioned, I am the chair of the Allied Health Council. And this position gives me a lot of exposure in the area of meeting people and discussing health and nutrition with a lot of our medical practitioners and other board members who are members of my council. I'm going to go straight into our subject for today, because I know that many of you are waiting with anticipation to hear what I have to say in regards to prostate health. I'm not here to speak on a specific subject such as prostate cancer. I'm here to speak on prostate health, because it's very important that our men knows exactly how to take care of their prostates. As men, as we get over the age of 40, many of us start seeing signs of prostate complaints, such as an enlarged prostate, prostatitis, inflammation of the prostate. Many men will get up very frequently at night to urinate, not knowing what is the cause. However, let me just, as a side note, let me just say that frequent urination does not only mean prostatic or enlarged prostate or prostatic benign hyperplasia. It can mean that your blood sugar level is very high and you're diabetic. So this is the reason why you're urinating very often. So even though I might say that you the frequency in urination or the retention of urine may be related to prostate, an enlarged prostate or benign prostatic hyperplasia, which is the same, an enlarged prostate, It also can mean that you are suffering from diabetes. Now, some of the symptoms that, as I mentioned, that most men do experience would be getting up several times in the night to urinate. And there are problems such as erectile dysfunction. There are also problems that you have difficulty passing the urine. So you probably will have to make several trips to the bathroom because when you go to pass that urine, the urine is not flowing freely. And so you have to go back to bed. Few minutes again, you'll have to get up, or half an hour, you have to get up to go back to the bathroom to urinate. And all of these are signs that you may have an enlarged prostate. What caused an enlarged prostate? There is an enzyme that is called 5-alpha reductase. And 5-alpha reductase stimulates another important hormone, which is a byproduct of your testosterone. So testosterone is a very important hormone. However, there's a byproduct that is called dihydrotestosterone. So the whole picture here is that 5-alpha reductase influences the increase of dihydrotestosterone. Dihydrotestosterone then would cause you to have this enlargement of the prostate. There's several studies have shown that this dihydrotestosterone may link to prostatic cancer. We'll get to that a little bit later, but let's stick with the dihydrotestosterone. So because of dihydrotestosterone, it actually caused you to have this enlargement of the prostate, or that growth spur that takes place in the prostate. So as I mentioned before, over the age of 40, most men would start having mild symptoms of prostatic enlargement. One of the best ways to deal with this, if you find you start having any kind of symptoms, is to make sure you go and see your doctor right away. Your doctor will do a rectal examination in which he inserts the finger to palpate the prostate from the rectal area. Your doctor is qualified enough to tell you if your prostate is enlarged, mildly enlarged, or there is not a big problem. And based on his examination, medication such as a reductase inhibitor may give, such as tirazosin, which is one of the most common ones that are given to men for enlarged prostate. That in itself will relax the prostate, relax the bladder, and at the same time will help you to urinate more freely and less trips to the bathroom at night. However, there are many other natural formulas which I will touch on a little bit later. And I know I do not have a lot of time to speak to you today because I only have about 15 minutes. But this is the first step that you should take whenever you start experiencing these kind of problems. Make sure you go to see your doctor. Do not think that it's going to go away on its own. It will never go away. It will only get worse, because as you get older, the prostate becomes more enlarged and the swelling continue to build up. So you need to be treated. There are integrative doctors, which some doctors now are medical doctors and also practice alternative medicine. And those doctors can also help you to choose within a reductase inhibitor or a natural formula that would help to reduce the size of the prostate. Now, as I mentioned about the reductase inhibitors, these are drugs, these are not natural products, but they have been shown over the years to help to reduce the size of the prostate and to allow a lot of men who are having problems urinating to allow them to urinate more freely. You do not want to get to the stage in which the prostate becomes so enlarged that a catheter has to be implanted or inserted. When a catheter is inserted, that is when it's really serious, because now you have a catheter and you have to you cannot use your penis to pee in the bathroom, pee anywhere. It's just everything goes into a bag and it's been emptied when it's filled. So this is why do not allow yourself to get to that stage in which you would have to use a catheter. And I encourage all men over the age of 40 to see your doctor even once or twice per year to have that rectal examination. Your doctor will also do a PSA test, that is prostate specific antigen test. This is a marker that will determine if you have prostatic cancer or not. This is where prostate screening is very important, because earlier you catch this condition is better for you. So that is the reason why your doctor will do a PSA test. And this PSA test, or if there's screening, wherever there's prostate screening, as a man, you should just go. It wouldn't take too long to take a sample of your blood and then send it to the lab, and the lab results will determine if you're suffering from prostate cancer or you just have a mild elevated PSA. Now, when I said mild elevated PSA, I'm speaking now. The normal is supposed to be between 0 to 4. So 4, let's just say 4 or 5.5 based on your age. So if you're under the age of 65 and you're on 4, that's fine. The new ruling now is 5.5 if you're over the age of 70 or up, because again, the antigen rises at that level. So it's not a big problem. Another very important point that I would like to make is that the intervention of some radical procedures sometimes are not warranted whenever a man has an enlarged prostate. Some physician or urologist would want to do surgery in order to reduce the size of the prostate, and that helps sometimes, but it also has its downside, such as involuntary passing of urine or incontinence. Also, in some cases, that men will complain about passing stool, involuntary. So there's both good and bad having prostate surgery to really reduce the size of the prostate. That is a procedure, I would say that's a last resort. The best way is that, as I mentioned, if you can work with a doctor that can treat you at an early stage, it is the best thing for you, because you do not want to wait until the prostate gets to the stage in which you have to have surgery or you have a catheter inserted. So to get back to the PSA, so whenever you have an elevated PSA, mildly elevated, that doesn't mean that you have prostate cancer. So let us say even your PSA is up to 20, and that does not really mean, based on your age, yes, if you're a young man under the age of 60, in your 50s, then you probably might need to do a biopsy to see if this is prostate cancer. At that stage, your doctor will determine what is the best treatment protocol for you, or what is the best protocol for you. This is a stage, if it comes back and you have half of those samples, or even 45 or 35 to 50% of those samples positive, you may need to do radiation or radiated seed implants, or most doctors will want to put you on remove the testes, or a prostatectomy, removal of the prostate. That is if you have prostatic cancer and you're at an age that this cancer is going to spread aggressively. If you're over the age of 65 and 70, there is a new phenomenon that says you watch and wait, or wait and watch, one or the other, watch and wait. So what that means is that you take your time, you watch to see the progress of your PSA. If it is increasing rapidly, it means that the cancer is aggressive, and it may then start to invade or to spread to the pelvic region. When that happens, then there's some level of metastasis that's sometimes very difficult to control, and radiation is the answer to that, at that time. This is something that I have been working with over the last, I would say, between 5 years, that I have seen a lot of men who have gone through all the different types of treatment protocol from different urologists. And some of them are at the stage 4, and in which they're told that there is nothing more that can be done for them because they've gone on all of these different treatments and they're taking hormone therapy and all of that. And I have developed a protocol, which is a treatment program to assist men who are at a late stage in their lives when it comes to prostate cancer. I am having PSAs at 4,950. When I see these patients, these are like dead people walking, because if you're a physician and you're listening to me right now, you would know that a PSA of that magnitude means that that person is going to die, and there's nothing much can be done for these people. So I'm not a magician. All I do is that I put them on a special program, and I have special formulas that I use on most of these men. My last case that I'm working right now with, this is a gentleman. He's 55 years old. He was told by the urologist that he probably has about 3 years to live because his PSA was 2,690. And he came to see me, and the good thing about what I'm saying here, I have the lab results that is available to anyone at any time. I will just remove the person's name for privacy, but these lab results doesn't lie. And so I do have all the information about these patients. Today, this gentleman, his last PSA was 1.5 after about 3 to 4 months treating him. So, as I said before, that I'm not a magician. I do everything in my power to help these men. And what I use is a very simple protocol that I use. This is not a protocol that I share with freely like that, because it's a protocol that I have developed over the years, and with lots of trial and errors, and a lot of research has gone into this to make sure that it is safe, effective, and it does the job. So mainly all I'm saying to you, gentlemen who might be listening to me right now, that you should seek other avenues if you have a very high PSA, and if you've been treated and there's not much can be done for you, then you should try to get your hands on this formula. Ms. Linton will actually put you in touch with me, and I can assist you. If you're a practitioner and you listen to this program, you can have access to my program. Only professionals I will share this program with, not the ordinary man, because they would not understand how it works. So there are other formulas. Again, as I just want to go back, I want this to be more of a discussion than a lecture. So this is the reason why I'm going back and forth into other areas that I've spoken before, because I want you to get it. I want you to understand that where you are right now, you're at the right place. You are in the right place. Screening is very important to make sure you do not have prostatic cancer. If your PSA is mildly high, you're over like 9, 5, 10 or so. As I mentioned before, there are times if you keep, let me go back and say, if you keep checking the PSA and it comes back all the time, it's just maybe mildly elevated, nothing much to talk about, or it stays one place all the time, it means that even though you may have prostatic cancer, it is not very aggressive. So there's also another phenomenon that says that you may quicker die from gray hair than die from prostate cancer with a non-aggressive type of prostate cancer. So surgical intervention at this time may not be the best option for you if your PSA levels are not rising very quickly. And even though again, that all depends upon your age and the aggressiveness of the PSA or of the prostatic cancer. An enlarged prostate, again, could also mean inflammation of the prostate. So if you have an enlarged prostate, it can be just inflammation of the prostate or an infection in the prostate in the case of prostatitis. Your doctor would prescribe you some antibiotics and other medication that will actually help to remove the infection if it is an infection that is causing the elevation. If it's not an infection and the PSA continue to increase, it means that there could be signs of prostatic cancer. If you want to opt for biopsy, and a lot of men do not like to do this biopsy because it's very invasive. And after biopsy, there's some, you get a lot of bleeding, a lot of burning in the urine, and all different types of symptoms. But in some cases, it's important to have a biopsy because you want to know where you are and at what stage your cancer is manifesting. So again, if you're suffering with an enlarged prostate, I'm recapping, if you're suffering with an enlarged prostate, please see your doctor. If your doctor will determine if you have prostate cancer, because even palpating the prostate from the rectal area can also tell if there is prostatic cancer or not. So but again, the doctor would correlate that with either an ultrasound to tell how many grams your prostate, the glands are, or they would do a PSA test. So sometimes they do all three in order to give you the proper diagnosis. So, okay, so now I am going to end here and I'm open for some questions. I hope that the bit of information that I share with you today, that you have learned something about prostate cancer. And again, some of the other conditions that might be related to having an elevated PSA. So I'm open for questions.
As Dr. McDowall mentioned, we are open for question and answer. But while we're doing that, we're just going to welcome some friends all the way from New Jersey. Kevin, it's nice to see you joining us today, as well as our counselor, Paul Leacock. He's on here as well. Our PSA team, thanks for joining. If any questions, please go ahead and raise your hand. Yes, we have a question from Paul Leacock. You may unmute and go ahead and ask.
Dr. McDowall, I wanted to know, you mentioned that you have the protocols that you found to be very helpful in your practice. Do you have any connection with any physicians or agencies in Barbados where those protocols can be shared so that we can benefit from them, or do we have to come to you?
All right, so John Linton, my dear friend, she can share that information with you. I would get it, make it available to her. But as I said, that these protocols should only be shared with professionals, with doctors, not really with the ordinary man, because these are protocols that need to be followed, and you have to be diagnosed with prostatic cancer, and also, but I do also have other programs for just an enlarged prostate, which is the prostatic hyperplasia. The reason why I think the protocols should be shared with medical practitioners, because they can follow you, they can guide you, there's always a follow-up. You doing it on your own will be self-medicated, and I would not want that. So that's the reason why as I mentioned before, that it is better that these protocols be shared with professionals who are in the field, such as medical practitioners or other naturopathic doctors.
Thanks very much, Dr. McDowall. Do we have any other follow-up questions?
Also, if there is anything that I've said there that you need translation, or do you need any form of interpretation, please do not hesitate. If I've used a word that you're not familiar with, and I'd be very happy to break it down to layman's terms.
Okay, I see Mr. Robinson has raised his hand, so you can go ahead and unmute Mr. Robinson and ask your question.
Good morning, Dr. McDowall and those on the Zoom meeting. First of all, I would like to publicly extend my thanks to Dr. McDowall. I would have been diagnosed with a pancreatic tumor in October 2018. Ms. Jan Linton would have put me on to Dr. McDowall, and he would have given me some advice which would have helped me greatly. I think the fact that I'm still here, having been diagnosed with a 4.7 centimeter tumor on my pancreas, speaks volumes for the effectiveness of his recommendations. Dr. McDowall, my question to you is, yes, you are not necessarily sharing the protocols with the laypersons, but could you outline the broad strategies that you are using within that protocol for the benefit of the audience?
Okay. Grandly, you're putting me in a very, very difficult and complicated position. All right. But Grandly, it's nice seeing you. I want to give the Lord thanks for you to be around so that you can be here today to ask me a question, Grandly. It's really, the Lord has been good to you. And I must say that you must give thanks always to the Lord for keeping us alive. It's such a great pleasure to see you and to make sure and know that you're here with us today. All right, so few of what I use, phytosterol, DIM, which is dimethane indole, which actually helps to control the hormones. And in cancer, especially prostatic cancer, there is this DIM regulates your testosterone levels, and also keeps out all kinds of pesticides and other forms of toxic chemicals. Many of these chemicals that sometimes are affecting us are hormonally related, just as PLA and many other abnormal estrogenic hormones. And so DIM regulates those hormones. As we become older as men, our estrogenic levels increases and our testosterone levels decrease. So what would happen, what we have noticed is that most men who are experiencing prostatic cancer, and even in some cases, the enlargement of the prostate, especially in a lot of young men, may be hormonally related. And so that is the reason why I have used DIM, dimethane indole, as one of the main ingredients in this formula. I cannot give you the milligrams, but it is a very important supplement for both prostatic cancer and breast cancer, because these two cancers at times are hormonally related. So you might find in a woman, she might have an abnormal amount of estrogen on her estrogen receptor cells. And these will actually create an increase or metastasis or the cancer spreading very quickly. So DIM, dimethane indole, control these hormones. So the part of the trick here is to control the hormones that are causing the cancer to be elevating or to be spreading very quickly or to be rapidly increasing in size in the case of having serious cases of angiogenesis. DIM also has shown some very positive effect on anti-angiogenesis conditions, such as it inhibits cancer cells from spreading, and it also causes cell death of cancer cells. And so DIM does not only control hormones, but it also inhibits. That is the word anti-angiogenesis means, to inhibit blood vessel formation. And so when you take this formula, it inhibits the cancer from spreading and automatically controls the PSA level. Another one is phytosterol, and phytosterol is another very important ingredient, which is hormonally again related. It controls the hormones, and it helps to reduce the amount of inflammation around the in the prostate. And at the same time, there are other formulas inside of the formula that alkalines the body. So it removes you from a high level of acidity to more alkalinity. So that's there are other formulas in it, such as the sapropeltaberry, the pygeum, and a few others. Cannot go through the whole formula with you because there's a lot of different ingredients that are in the formula. I also use something called in St. Vincent, I know they call it gully root. Here, there's a Creole name for it, so they do not know it as gully root. In Jamaica, they call it guinea hen. There is a Jamaican scientist who've been researching this for the last maybe 15 years, and have came up with a very unique formula in it that is also helping a lot of prostate cancer patients. And this is also part of the protocol, or part of the program. It's not just one product, it's a program. So I use other things in the program to assist as complementary to some of the main ingredients. That's the most I can say, Bradley.
Thank you very much.
You're welcome.
Okay, thank you so much, Grantley and Dr. McDowall. We will allow for one more question before we hand over to Nurse Noel Archer for the vote of thanks.
Always remember that any question you ask is very important. There's no silly question. There's always a question you can generate something very special or some answers from it. So you do have me here right now. You can ask your question.
Hey, I'm Chesterfield Brown. I have a question in relation to prostatic surgery. What are some of the complications of say something like a prostatectomy? What are some of the possible complications of having a full prostatectomy?
Incontinence, which you urinate sometimes involuntarily, like a passing of urine involuntarily, erectile dysfunction, and mainly I would say erectile dysfunction in incontinence. Having a full prostatectomy, at times does not really has too many different symptoms, but erectile dysfunction is one of the main ones, and then the incontinence in some cases. And there are some men who sometimes may pass a bit of stool while they're urinating, they pass stool at the same time. I do have a few patients who have had those symptoms, but again, the main one is really the erectile dysfunction. And for the erectile dysfunction, your doctor probably would, can recommend Cialis or Viagra, but we do have a special natural product that seems to be working extremely well here on the island and around the region. It's called Enhance, and Enhance will also help you to perform sexually, because this, if you are sexually active, then this will be one thing that you're going to be void of, is to not having a problem, to enjoy the pleasure of your partner. So I will say erectile dysfunction is one of the main ones when you have a prostatectomy. For some men, this might not be for everybody, but for most men, erectile dysfunction is the main symptom.
Thank you, sir.
Yeah.
Thank you so much, Mr. Brown. We have one last question from Kevin Stout. Go ahead and unmute.
Good morning, doctor.
Hello.
So my question is actually a follow-up to what you said before in regards to your protocol and your formula for treatment. Now, are there any supplements on the market that can control an enlarged prostate? And also, secondly, is there any value to a controlled diet that would also help with that?
Very, very, very good question. Very good question. Diet plays a very important role. So if you do have an enlarged prostate, you have to be on a diet that is low, that can produce less inflammation. So a diet of like lots of vegetables, very small amount of starches, especially refined, revitalized starches. You need to increase turmeric in your diet, because turmeric has powerful anti-inflammatory properties. So you cook with turmeric, or you can take turmeric capsules. You drink adequate amount of water daily. You take a balanced one-a-day multivitamin plus mineral. This is vital for all of us, because our diet is so deficient in important nutrients that most of us are nutritionally deficient. So this is why diet plays a very important role. So adequate amount of water and a balanced diet plays a very important role to reduce the level of inflammation. I would like to emphasize again, inflammation plays a very important role in a lot of the health problems that we are seeing. So if you can take something that has powerful anti-inflammatory properties, especially something that's natural, and nothing beats turmeric. Turmeric has been shown in every way to reduce inflammation, even inflammation around the amyloid area in the brain that can cause senility or Alzheimer's. Turmeric reduces the inflammation of the brain. So there's nothing better that you can use to reduce inflammation, and you can use it in your cooking. It is very simple, and most of us use curry powder. Curry powder is okay, not a problem. 90% of what is in curry powder is turmeric. But if you can put your hands on pure turmeric, it's the best thing to use. So yes, I welcome that question. And yes, there are many formulas on the market that you can use. And right here in Barbados, I'm sure you probably will find different health food stores that will carry, prostate formulas that will help to keep the prostate healthy and to prevent the benign prostatic hyperplasia, which is an enlarged prostate. So that's a very good question, and I hope that many of the other men who are listening will follow some of these advice. There are other things like sapropeltoberries, pygium. Most of the formulas will contain those, and the phytosterol. If you get a good balance prostate formula, it will help you to control the urinary incontinence and also getting up several times a night to urinate.
Thank you so very much, Kevin. A question all the way from New Jersey. Antigen says thanks. We're going to hand over now to Nurse Noel Archer. Noel, you're there?
Yes, please. Can you hear me?
Yes, I can hear you. Yes.
Thank you very much, Mr. Dr. McDowall. Your information has been exceptionally informative, and not only informative, but simple and very direct. And I really and truly appreciated that. I also want to say, when you go to a restaurant, you have very much dishes, and the chef is normally the person who, get paid the most money because he does his own little recipes. So although they've been asking you constantly about your recipe, I think you should got copyrights on your recipe. I'm really grateful for that.
Yes.
I agree with you 100%.
Yes,
but as I said, we are truly grateful here at Cancer Support Services to have your resource, and we appreciate you taking your time out to educate not only our staff, but persons who frequent this place. And we are, again, very thankful to you. Thank you, sir.
Thank you.
Thank you so much, Noel. We'll just have, if there's anyone with one last question before we sign off.
All right, so to wrap up, let me just say that if you want any of my formulas, Mrs. Linton, Jan, can get in touch with me, and I would probably send whatever you require to her, and then she would dispense it to you. Everything would come already prescribed and written up in a way that is very simple to follow. Your number would be shared with me, especially if you're someone suffering with prostate cancer. Your number would be shared with me. My number would be shared with you, so you can contact me at any time. But before I do any form of shipping or ship any of my formulas to anyone, especially a prostate cancer patient, I must have his last PSA. I will not ship a formula to anyone unless I have a PSA test. And the formulas will be only shipped to patients with prostate cancer based on their need, and also to them specifically. I would not send this formula to be dispensed by anyone without I have a PSA of that person. I must have a PSA. I must have some type of medical record so that I can correlate. I can know exactly where we are here today and the next few months down the road where you are. So, this is very important for me, because I keep records of all of these cases that I've worked with over the years. And so I know exactly, who I'm working with and what treatment they're being received by me. Okay, so just like you to know, this program will not be sent unless I have a PSA of each man who need to go on this program. So again, I want to thank you so much for having me, and it's really a pleasure speaking to you. I hope that sometime in the future we can speak again And this was on short notice, and as you notice, most of what I spoke about is just from memory, hardly did any kind of reading, it's just from memory. So you have to excuse me if I keep going back and forth, it's all from memory. All right.
Dr. McDowell, thank you so very much. We pulled this off within 2 days, but we're looking for you in Barbados very soon, very, very soon. You've been away too long.
Yes, thank you.
Thank you, thank you.
All right. Thank you all for joining us. This has been Prostate Health with Dr. Almus McDowall, all the way from St. Lucia. Keep up to date with cancer support services by following us on Facebook and Instagram. We are located on Darrows Road, Christchurch, for our persons in Barbados, and we will be having more lectures coming soon. So follow us, like us, and share. Thank you all so much.
Thank
Dr.
you.
McDowell. Oh, and Dr. McDowell, if you don't mind just briefly mentioning your website.
It is www.mcdowellproducts.com. www.mcdowellsproducts.com.
Thank you so much. And if you search
Yes.
Dr. Almus McDowell on Google, you'll more than likely find that information as well.
Yes.
So thank you all so much for joining us, and we look forward to the next Zoom.
Thank you. Have a blessed day.
Thank you. God bless you too.
Yes, thank you.